Thank you, and thanks, Elisa, for having me here. I like it. I like the view. Unfortunately, Katie, I don't have great results to present. I'm just giving an update on behalf of Minorix. They couldn't make it here, and since I serve as the PI for this study, global PI, I suppose, they asked me to present. I just want to have a comment on the last talk because Katie was put a little bit on the hot seat. I would say there's one thing that's really important. We are in an area of a very complex disease with an expanding phenotype, with more and more things that we are learning, and there is way stuff that we still don't really know. When you're in a gray zone area where you don't really know, it's very easy to become camps. You take one side, you take the other side. Maybe some resemblance to things happening in the world, right? I'm not going to go into it. Anyway, I think it's critical for us to stay as a community and embrace it that there are unknown variables and have conversations without camping up to different sides. And that's, I think, really critical. So thanks for doing this, Katie. I know it's a hot... Yeah, I know. Anyway, so moving on. So what is the CALYX study? So CALYX study is basically a investigational clinical trial that's sponsored by a company called Minorix to study the effect of a drug called liraglutazone and see if it's helping in adult cerebral ALD in men. So exactly the issue that Katie just set the stage for. Just full disclosure, Kennedy Krieger, where I work, has received funding from this company. I'm the global PI, so not me personally, but our institution has received funding from it. And actually, these slides were prepared by Minorix, so you can blame it all on them. The only thing that's not there is this first slide, which is talking about the MRI again. I think we can skip this because Katie basically mentioned this issue. The one thing I want to say is that the estimate based on the cohorts that we have from Kennedy Krieger, Boston, and from Germany and Leipzig is that basically patients with mild symptoms and gadolinium-enhancing MRI lesions, 50% of them will die within 3 to 4 days if untreated. And so this is critical, in terms of prognosis, but also why we have the clinical trial design as is, and I get into it in a minute. The precedent for this clinical trial was a discovery in the lab in Spain by Dr. Aurora Pujol that a drug called pioglitazone seemed to improve basically the function of mice with ALD. And pioglitazone is a diabetes drug. It can cause hypoglycemia. It has lots of issues. So there was a drug that was developed by this company called liraglutazone, which doesn't cause the hypoglycemia and has less of the side effects that pioglitazone has. And this study was preceded by this other trial where this was the first clinical trial in ALD where we treated 116 men with AMN. This was a multinational, multi-center study. Many centers were involved. And the objective of that study was to see if AMN symptoms, so the myelopathy symptoms in adults men with ALD, would improve. The primary outcome measure of that study was a 6-minute walk test, and the results was negative. Okay, so the liraglutazone did not change the primary outcome of that study. But as a side observation, one thing that was seen there was that it looked like there was the individuals who received placebo as opposed to the active drug had a higher chance to show either a worsening of their MRI score or a worsening of the lesion volume in their brain if they had lesions. And some of them didn't have any lesions and actually developed new lesions. So this was a small subset of these patients. From these 116, I believe there was 6 or so that developed this worsening cerebral ALD progression. So it wasn't sufficient to make too much of a conclusion, but it basically gave rise to a lot of discussions with the FDA, which then led to the design of this current study called the CALYX study. And so one of the key things with the FDA was that the FDA was saying, well, what I actually first mentioned, there's so much unknown here. Like, for example, what is the rate of the progression of the MRI? What is the rate of clinical progression in this disease? The one variable that we really can take as a hard outcome is survival. And so this is actually a placebo-controlled trial where the primary outcome is whether men will survive longer if they get this drug. Okay, so that's a very crude measure, unfortunately, but that's the one thing that they could agree on from a statistical perspective. So this one is a 1-to-1 placebo-controlled trial where one subject so each subject gets randomized. You have a 50-50 chance to get the drug or a placebo, and the total trial duration is 36 months. However, after 18 months, everybody has an interim analysis once we have 18 months data together. If you see a positive effect there already, so if the drug effect is strong, then the FDA has agreed to review that result and may consider even approval after 18 months of study duration. If not, then the study will be continued for an additional 9 months with another round of analysis, and then finally at 36 months, the study will be completed. And then at the completion of the study, currently there is a plan for what they call an open label extension. So everybody then will roll over and get the drug until the FDA determines what's going to happen to this drug. The objective here is to enroll 40 men with cerebral ALD. And it's been really challenging to find those 40 men for reasons that Katie discussed earlier. So the company has been expanding their sites. We now have a lot of sites in the US, in South America. We now have 3 sites in the European Union. We have the UK, which is no longer part of the European Union, and even a site in India. The inclusion criteria are adult men who are older than 18, who have an abnormal brain MRI that shows gadolinium-enhancing lesions, and they have to have an MRI severity score of 12 or less. They can't have any major functional disability, although they can be wheelchair-bound or have total incontinence if it's related, essentially, because many men have AMN and have those issues as part of AMN. And they cannot have had a prior gene therapy or bone marrow transplant study prior to the enrollment. Because this is a related drug to diabetes, remember I mentioned that earlier, they can have type 1 or type 2 diabetes. In some animal studies, it has been shown that that's not this drug, pioglitazone, can potentially induce, actually also even with this drug, could induce some tumors, and especially I think in the bladder. And so because of that, there has been pretty rigorous monitoring. And so far, we haven't seen anything like that even close in any of the subjects who received the drug. They can have a history of heart disease, and they can obviously have any MRI incompatibility. So they can have like implants that will make it impossible for them to have an MRI. There's ongoing recruitment, as I mentioned. The outcome is primarily survival. There's a whole host of secondary things that we are measuring. We're measuring a whole host of neurological tests and assessments in terms of cognitive function, motor function, and so on, and quality of life, and several scales, and so on, and also, of course, safety measures. The study has a bunch of visits. As you can see here, this is a table of visits. So you see each of these is a visit, V2, V minus 2, V minus 1, then baseline, and the whole host of them. Several of them can be done, via a home visit with a home visiting nurse, which are basically just safety visits. So there's no admission needed for this study. The patients come, they're seen in the clinic, they get their initial evaluation and screening done there, and then they are enrolled right away. The medication is a solution and it's taken daily, so it's a pretty straightforward thing to do. There's no injection, there's no infusion. And the side effects so far that has been observed are primarily edema or swelling in your ankles and feet, and weight gain. Also some periorbital edema, so edema around the eyes. So the guys just get a little bulkier, I would say. So these are the study sites that you can see in the US. Actually for Baltimore, you should say Dr. Malik, he took over as the site PI. Sorry, Eric. And then these are the European sites, and as I mentioned, there's an Indian site now. So these are the number of, so there's 5 additional sites that are being worked on. The challenge, again, remains to recruit the number of patients. We need to have 40 patients. There has been 100 57 patients that have been pre-screened for this, meaning they're undergoing MRIs to see if they qualify for this study so far in the last couple of years that the study started. So far, I believe as of mid-March, the enrollment numbers were 18 total. So we're still missing more than half of the subjects to reach the goal. So the study is ongoing. They're really, if you know of anyone who's interested, please let them know. The company is going to do some outsource, some reach out to try to sort of outreach, to try to improve enrollment. They're engaging now with several newborn screening labs to try to make sure that if there is an ALD boy identified, that they can try to do extended family screening and identify potential, uncles or grandfathers who could be at risk. They're also engaged now with, I thought, with the genetic counseling societies and genetic counselors working specifically with those newborn screening follow-up programs to, again, make sure that there is extended family screening and make sure that they are aware of this clinical trial. Like Katie mentioned, there's actually, depending on which sites IRB has approved it, a potential compensation for patients to undergo these MRIs. And the company pays for these studies. So if you have any questions, you have here the contact information on the Minorix that you can reach out to. So unfortunately, again, no data yet because we're still enrolling. But I thought it was important to let everybody know that this is an ongoing study. Thank you. Any questions?
Hi, hello? Hi, can you hear me? Yeah, there we go. So thank you for that great presentation. I have two questions. One is, you mentioned that being recommended to go to transplant or willing to go to transplant is an exclusionary criteria. I'm curious, in the enrollment process, how many patients are being excluded for that reason?
So the company has sort of deferred to each investigator and patient, whether because the truth is now that based on the experience from adult bone marrow transplant, there are many men who could potentially qualify for a bone marrow transplant, especially those with early stages of cerebral ALD, those with not too severe myelopathy symptoms, those who are not yet using a cane, and so on. But it's left at this point to the discretion of each site and each patient, because many patients still don't want to do that. They don't want to, have an allogeneic bone marrow transplantation with chemotherapy and all its anticipated side effects. The outcome data in the adult bone marrow transplants is still mixed, like depending on how, again, you can slice and dice it and look at a certain group that seems like is doing well, and then many others don't do so well. So the company basically just says, as long as they're not getting bone marrow transplant, and there's more or less left over. There's also a lot of social issues that come with transplant, long-term hospitalization and so on. Now, there, you're definitely getting a treatment. It's a question if it's working or not. Here, you have a 50% chance to get an investigational drug. So first, we don't know if it's working, right? That's why we have this trial. And this trial is to answer that question. So it's not to assume that this drug is helping. Second, it's a 50-50 chance that you even get the drug for the first 3 years. And so that's part of the challenge with recruitment is also people just like, why would I do this? So, yeah.
And then my second question was, I think I just missed it. You put up your different measures that you're using. I'm curious about whether you have any measures of psychiatric symptoms in this population. That's been reported quite a lot in men with cerebral ALD as being important. And I'm wondering, just even for, examining the baseline symptomatology, whether you have those measures.
So cognitive assessments are done. The quality of life surveys include depression scales. Now, there isn't a thorough, comprehensive neuropsych assessment done. It's not a 4-hour test. These are scales. They're rapid tests. They're more like sort of tools for which we already have some data in the past. One of them is called ACS, the neurocognitive component that seems to be pretty strongly reflecting the progression of the disease. So that's what we're collecting. But there's no psychiatrist involved in that, if that's what you're asking. Yeah.
Thank you.
Yeah. Keith?
Would be my and could read happen.
I don't have a hearing aid. So you,
Okay,
oh, now
there we
it
go.
works. Come closer. Yeah.
Just to reiterate for everybody who's listening and for people who know people, can you just really quickly recap in simple language who's eligible? Also, the possibility of free screening MRIs with some incentive, just to kind of drive the point home.
Sure. So again, this is for men only, not women. It's for adults, so anybody older than 18. There's no upper age limit, and they have to have cerebral ALD, and they have to have a gadolinium positive lesion. So if the lesion is not GAD positive, they don't qualify for this study. That's sort of the base idea. And then there's the exclusion things that I mentioned, like you can't have it if you have diabetes or if you receive prior transplant or gene therapy and so on. In terms of the process, so you're supposed to get a so-called pre-screening MRI. So that's an MRI that needs to be done to determine if you have a cerebral ALD or not. And the company has been accepting not only to get that done on each site, but they also agree to review outside MRI. So if you go to your community hospital and you get an MRI, that is accepted. And in fact, they have been paying, at least for the last year or so, for those outside MRIs to get them done.
So my son is in your program, and I'm just curious, you said after 36 months, do they get put on the medication, the actual medication, if they're on the placebo?
No, well, if they are on the drug, they're just going to continue. And so after 36 months, everybody will be on the drug.
After 6 months?
36 months.
36
So 3 years.
All right.
Now the issue is, that's what the company is saying now, after the completion of the study. We have had people who were enrolled almost 2 years ago. So they're going to finish in a year the study. And so the reason we have this open label extension is, since we don't know the answer yet, because we need to enroll all 40 patients, the company will switch those patients over all to the active drug while we are still trying to figure out if this drug is working. The idea is that you don't want to, in case the drug is working, you don't want to deprive people of the access to it. So that's at least what the company has promised at this point.
So even if there's an increase in their lay scale, you cannot assure that they're getting the medication?
No, it's a placebo-controlled trial. It's double-blinded. Nobody knows who's getting what except the pharmacist. They are the only ones who have the key. And again, because we don't know whether this drug is effective or not, if you see in the rest of that's why it is placebo-controlled. So because there are individuals, so I should have mentioned that earlier, there are adult cerebral ALD patients who have MRI changes and they just don't change. Or they may progress for some time and the progression may slow down or stop entirely. It's not exactly like in the boys that you can almost for 90% of the time say they're going to progress. So there's more variability there, we have less data there, and that's why the FDA wanted this clear, sort of clean, double-blind, placebo-controlled trial where survival is your outcome. They didn't want to use the MRI as an outcome. They thought that there was just not enough data to...
I guess I'm just petrified because his lay scale is already at 11.
Yeah.
So I just...
Yeah, I agree with you. Yeah. Because somebody who already has an MRI score of, let's say, 11 or 12 at baseline, if it goes on placebo, will likely, may, if the disease continues to progress, may not make it to 36 months. Yeah.
All right. I don't know what do you think.
Sorry. Thank you.